Let me share with you 3 things I know to be true. Number 1, there's a great order of things in life. Number 2, it's not a coincidence that the year 2020 was made the International Year of the Nurse and Midwife to commemorate Florence Nightingale's 200th birthday, to help us remember that the year 2020 is the year where hand washing is strongly enforced. And number 3, I believe that it's time for healthcare to be reformed. I've been a nurse for over 30 years, and I've spent most of those 30 years in the front lines taking care of patients with stress-related ailments. In the last decade, I've decided that because it's time for the healthcare workers to gain the attention, to gain the care that's needed to take care of their job stress and burnout, I've decided to start doing trainings and programs to help them find the time, micro moments of time during their busy day to take care of themselves. So during COVID, I've spent most of my time creating a mindfulness pathway for a digital health company, doing mindfulness programs for CEOs and CNOs, talking and coaching groups of nurses on how they can use research-proven self-care skills to help them feel good about themselves at that moment and hopefully find ways to gain a sense of peace and relief at night when they're not working. Every week, it seems, there are news headlines telling us that mental health of the healthcare workers must be taken care of. There's so many different worries and fears about what can happen after COVID is gone. What's going to happen to the healthcare professionals? Who is going to be taking care of them? Who's going to be left? Before COVID, the ANA did a survey, and basically in that survey they found that the average American is much healthier than the average nurse. This was before COVID. And once COVID hit, all this job stress, burnout, PTSD, secondary trauma, that has been put on steroids. Nurses, doctors, all frontline workers have been impacted negatively from the burden, the job stress, the pressure from being deployed, and just all the extra worries that they've never had to worry about before, such as their own health and safety, such as their family's own health and safety, such as coming home and sleeping in their own beds. Healthcare needs to be reformed. One of the best ways to do that is just to start redefining what healthcare really is. And if we could take another step back, perhaps adding self-care to the definition of healthcare. Healthcare must start with self-care. We as healthcare providers must start taking the time to take care of ourselves during the day. It must be mandated, just as hand washing is mandated for all of us to do, so that way we're not infecting other people. We must take the time to take care of ourselves in micro moments of time during a day, so that we're constantly washing away any job stress, burnout, any type of feelings, negative feelings that's keeping us from feeling our best and doing our best. Healthcare must start with self-care. I believe if we could start changing the definition of healthcare to include self-care, this new world will become a much healthier and a much happier place. Thank you so much. My name is Debbie Lynn Toomey. I've been a nurse for over 30 years, and I wish you a healthy and happy day.